So the top 3 nutritional tips for helping patients when they lose their appetite. The first one I would mention is that we want to capitalize on when is their appetite the strongest. In the American culture, we tend to have oftentimes a lighter breakfast and lunch and have our main primary larger meal at dinner. But I find oftentimes cancer patients have the worst appetite at dinner. And so if they do that, they simply can't consume much and they end up consuming fewer calories overall. So we want to kind of flip that, providing a patient with a robust breakfast and or lunch, and then allowing the patient to have a lighter dinner, so that you're utilizing kind of when do they have the greatest appetite, to help provide, get in the most calories during that time. So the second tip I would say is to provide patients with high, healthy, caloric, nutrient-dense foods, yet in a small volume, that are also easy to consume from an energetic perspective. For example, a bowl of beautiful orange raw carrots would be fantastic, but the amount of energy to consume those carrots is too daunting, and a patient may just simply say, oh, no, thank you. If instead we presented a patient with a bowl of pureed carrot ginger soup, then that may be much more easier to consume, that way. Plus, you could then even add in, collagen peptides and our protein to be able to not change the volume, but add more nutrient density to the same, 1 cup serving, for example. Salads, oftentimes patients don't have much interest for when they don't have an appetite. So instead of having a big, beautiful green salad, we may want to offer a small plate or small little dollop even of, sauteed greens with garlic. Additionally, animal protein tends to not be very palatable when somebody doesn't feel well and they're not having much of an appetite. And so if you present a patient with a chicken breast, they may say, oh, no, thank you. The amount of, again, the energy to cut that up, to chew that up, too much. But if we had shredded chicken in a soup, then they could more easily consume that and still be able to, get in their protein, that way. So soups and smoothies tend to be a very common way of getting in a high amount of, caloric density, high nutritious, calorically dense foods. And the third tip I would say to help really improve appetite would go along with taste. Because one of the reasons patients generally complain about not having much of an appetite is that the food doesn't taste very good. And it could be that food tastes metallic, more rarely so, but if that's the case, sometimes that means that there's a deficiency in zinc. But more frequently, a patient will say the food just tastes off. It just tastes blunted. It does taste like cardboard. There's just not much taste. And then, of course, if you don't have an appetite, the food doesn't taste good, you're a lot less inclined to eat very much. So how can we improve the taste, the flavor of the food? And there's an acronym that I use frequently for patients. I think it was originally coined by Rebecca Katz, who is a chef and author of some cookbooks in the North, in Marin area in San Francisco, in the Bay Area. But it's FASS, F-A-S-S, and that's an acronym for fat, acid, salt, and sweet. So any food that a patient is eating is there a little bit of oil in that food? Does that mean is there a little avocado, a little olive oil, a little bit of a nut, a little bit of a nut butter? What about acid? Sometimes I find even acid may be even the key component there is a light little squeeze of lemon or lime or a dash of vinegar can really help those flavors pop. And again, if the flavor is there, then that'll be much more palatable to a patient who doesn't have much of an appetite, and then hopefully help to improve how much they're eating overall. And then again, making sure there's maybe a dash of salt and even possibly sweet. And I don't mean that we're gonna pour maple syrup all over a chicken breast necessarily, but that we would want to, possibly consider just even a tiny little drop of something a little sweet. Could even be applesauce or a little banana or a dash of maple or honey that can really help even a savory soup or a savory dish come to life and be that much more flavorful. So improving flavor could be significant in improving their likelihood of eating more and helping with their appetite.